not the stretch. I feel a stretch at my hip. There's no reason for me to be that way. So cue that posterior pelvic tilt. Okay, so kneeling or in a lunge position. You can do the Thomas test position, where the person is hanging their leg either off the side or off the edge of the bed. Again, this is based on patient ability. My patients cannot do that. Some of them can do the hip flexor stretch on the floor, some of them can't. So that's another option. You're gonna slowly lower the leg to the ground. Don't let them drop. If they drop, what happens?
Bash their knee.
They could, well, if they're on their back.
Level 4.
What happens? What happens with a quick stretch on the muscle?
Muscle spindles.
You get it, the muscle spindle fire. You could get a spasm, and it could hurt. So they're not to drop their leg. If you want to keep it just hip flexors, there should be no external rotation or abduction. Okay, that's actually putting some of the muscles, like taking the slack off muscles. If you're seeing that, depends on what you want to bias. Okay, the glute max is actually in quadruped. You are getting an anterior pelvic tilt and then going into hip flexion. Okay. Does anybody want to try that? You coming up? Come on up then. You walked. Let's do it. You walked. You walked. That's enough for me to catch my eye. So, quad. Good. It's not quite child's pose. What's different about this one? Arch your back. Good. Now go into hip flexion. Keep that. So what's different about this in child's pose?
Lumbar.
Right. So in child's pose, the lumbar flexes. I don't want her to do that. I want you to keep that arch. Keep that arch. So I'm arching, I'm not allowing motion to happen at the lumbar spine, and it's just going into hip flexion, stretching the hip extensors, okay? It feels pretty good, right? That's probably the upper glute that you're feeling, right? Yeah. So remember, the upper glute is the powerful superficial muscle. It has a tendency to be a little bit overactive. So stretching this will probably target more of that than the lower glute, okay? The option for the adductors, you can relax. This is a funny one. I don't expect you guys to do this one. This is with somebody leaning against the wall and their legs are opening a V. I've never once given this as an exercise, but it's in your book and I find it funny, so I love it.
It's good though.
It is. Have you done it? Okay, I have not ever done it, so
It's a happy
it's
baby.
definitely an option.
Yeah.
Yeah. Oh, that's the happy baby.
Yeah.
Oh,
And then you like extend the legs out.
Oh, okay.
It actually
So-
feels really good.
Okay, so an option. I've never done it or given it. It is. So the one that I tend to do and the one that I tend to give is the wider stance adductor. Now, not really expecting you to focus on the anterior versus the posterior adductors, but you can bias this stretch because this one, the reason I don't really do it is because what position are the hips in?
Flexion.
So the anterior adductors contribute to flexion. Are you going to get the anterior adductors?
No.
Not really. With this one, you can either do straight abduction to get all the adductors, or if I step forward, what position is my hip in? So what am I biasing? The more anterior adductors, yeah. So I'm going into abduction, biasing the anteriors. If I take a step back and go this way, now my hip is in flexion, so I'm getting a little bit more of the posterior fibers of the adductor magnus. So just be aware that when you give a stretch, how is it aligning with all the actions of the muscle, right? That's why I tend to not do this one as much, because for me, it's more the posterior fibers that I need to stretch. We're not going to ask you that, but I just want to make you aware of those differences when you give stretches.
What about a skater stretch?
The skater stretch, is that this one?
Here.
Same thing, what position are your hips in?
Flexion.
Flexion, so it's the same rules apply. And even with this one, what position are the hips in? Flexion and external rotation. So it's a big external rotator stretch with hips in the flexion position. You can do them. There's no wrong stretch other than if it doesn't accomplish what you're trying to accomplish. Okay, if any of the stretches with hip flexion work, then that's fine. That was their restriction. So you just have to be really careful with what you give somebody and if it's actually getting the muscles you're targeting. That's all. But there's tons of options for it. And this is a self-stretch into internal rotation where you're just hooking your arm and pulling your leg into internal rotation. But again, keep in mind, the hip is in slight flexion. So if there's an issue with extension and internal range of motion, then you'd want to put them into more of a hip extension moment before doing the internal rotation. And that's all that I just want you to be aware of is the different positions. Okay, there's a ton of different ways somebody can stretch their hamstring. They can put their foot in a doorway, they can have their leg up on the table. What's the most important thing when you're guiding somebody? Do you want to see this? No.
Flat back. Neutral back.
Hinge at the hips, right? What crosses what goes behind the leg, crosses through the pelvis, into the lumbar spine, and up to the spinal cord and the sciatic nerve. So if you're stretching somebody into hamstring flexion, do you want to dorsiflex their foot? No. Because what are you really stretching?
Nerve.
The nerve. Okay, so that's a big thing that you see in clinics and gym. With this as well, that posterior pelvic tilt, it's first off taking stretch off the hamstring, but it's now applying a stretch up the spinal cord and you're stretching nerves. It's a good way to flare somebody up. So you have to make sure that you're stretching what you want to stretch. There's another fun one on the ground. Same concept applies though. You have to make sure they do not round their back. And then this is an active stretch. So somebody can simply be kicking their leg up into flexion to get an active stretch of the hamstring. So this is not a static hold. IT band. Has anyone done this one? This one might be something I have you guys all try. So you're looking at the leg that is close to the wall is what's being stretched. So if you're here on the mat, it's this leg that's being stretched. Okay, so what does the TFL do at the hip? Okay, so it internally rotates. So it internally rotates, flexes, and abducts. So it does something like that. So I do the opposite. I'm now in hip extension, externally rotated, and if I lean, I have to keep my pelvis forward. If I lean, I'm now putting it into adduction. Okay? So you want to make sure that they don't rotate back at the hips, that it's true extension. I don't have any extension, so it's hard for me to get into it. You can cross the other foot over to get even more adduction, and then I just lean. Okay? And that'll get the TFL. As long as I don't, if I can ever stop compensating at my low back, I'd actually feel it there. But if they're doing it correctly, they'll feel the stretch in the TFL. Okay, just keep in mind, it's the leg that's closest that's being stretched, not the outer leg. The other option to the IT and TFL really is lying on your side, but doing the same thing. External rotation, dropping it into adduction and extension. So those are the stretches you can give your patients. Piriformis, different options. Remember that it does change based on the position of the hip. So you can have seated, you can have, I feel like they call this pigeon.
Yeah.
Right,
Yeah, it's
when you're in
pigeon.
there, so that's pigeon with the arms crossed, bringing your legs, or with the legs crossed, bringing them knees to chest, or on the mat. Okay, all different options, just depending on what you're trying to do and what works best for your patients. All right, so we're running relatively